Did you know that, according to constitutional studies, prostate cancer is one of the most common types of tumors in men worldwide? Unfortunately, many people still ignore some signs that can lead to the onset of the disease. That's what we're going to talk about today: the first symptoms you can't ignore, the most significant risk factors, and the preventive measures every man should know. Stay with us until the end to learn how to recognize potential changes in its pattern and provide effective treatment if needed. Understanding prostate rollers. The prostate gland is a gland in the male reproductive system located just below the bladder and in front of the rectum. Despite its small size, it plays a crucial role in secreting part of the fluid that makes up semen, helping to nourish and protect sperm. When this iron structure is out of balance, whether it is supporting, for example, with prostatitis or the appearance of abnormal cells, the entire body can be considered with negative consequences. Prostate cancer occurs when the prostate gland forms mutations and begins to multiply cells uncontrollably, reliably forming a tumor. In most cases, it is a slowly developing disease, but in some cases it can take on an aggressive character, spreading to other parts of the body. Understanding the function and location of the prostate gland is the first step in recognizing possible warning signs. The importance of early diagnosis. The key measure in the region with prostate cancer is early diagnosis. In the early stages, the tumor may not cause obvious symptoms, as a result of which many men live with the disease without suspecting it. This is why regular monitoring, such as PSA, prostate-specific antigen tests, and rectal examinations, are so important. With early diagnosis, treatment progresses significantly ages. In addition, therapeutic approaches can be less invasive. However, the stigma and fear surrounding digital rectal examinations still discourage many men from seeking medical attention. It is important to always put your health first. Overcoming cultural barriers and prejudices can save lives. What can trigger the disease? There are several risks associated with the development of prostate cancer drugs. Age is one of the main ones. Men over 50 years of age have a significantly higher risk of developing the disease, although there are also cases of early onset of the disease. Family history also plays a role. If first-degree relatives, father or brothers, have been diagnosed with prostate cancer, the likelihood of developing it will increase significantly. Moreover, race can be a guarantee. Black men have higher rates of prostate tumor development compared to men of other ethnic groups. Another important aspect is lifestyle. Diets high in animal products, inactivity, and excess weight can contribute to the improvement and progression of cancer cells. For this reason, medical consultations often recommend a healthy diet and regular exercise. Symptom 1. Changes in urination. The first symptom that many men notice when the prostate gland begins to show in size or an imbalance occurs is a change in urination. There may be difficulty starting to urinate, a weak stream of urine, or even interruption in the middle of emptying the bladder. The feeling of insufficiency of the bladder musculoskeletal system can lead to rejection and anxiety. Although these signs are often associated with a benign disease called prostatic hyperplasia, they can also be foci of prostate cancer, especially in the early stages. Therefore, if you notice changes in urination, be vigilant and consult a doctor. The sooner the cause is determined, the higher the rate of effective treatment. Symptom 2. Increased frequency of urination at night. Another symptom that many men tend to side with is the need to wake up several times during the night to urinate, nocturia. This can be due to a variety of causes, including infection, poorly controlled diabetes, and of course, changes in the prostate gland. When the pressure of the gland increases in size, it puts pressure on the bladder, causing frequent urges to urinate. Interrupted sleep due to trips to the toilet reduces quality of life, leading to increased fatigue and irritability. Although this may seem normal as you age, it is not a symptom to be underestimated. If the situation worsens or other symptoms are observed, such as pain or burning when urinating, it is necessary to consult a doctor to avoid more serious problems. Symptom 3. Presence of blood in urine or semen. Hematuria. hematospermia, blood in urine or semen, is a warning sign that should be avoided. Although they can have various causes, including urinary tract infections, kidney stones and other conditions, when associated with the prostate, they can lead to the presence of tumor lesions. This symptom caused by cancer often appears in later stages, although each body reacts differently. Exercise caution if you notice blood in body fluids and consult a doctor as soon as possible. Imaging studies, lab tests, and possibly a biopsy will be crucial to determine the source of the blood. Even if the cause is not cancerous, any non-obvious disease should not be ignored and investigated. Symptom 4. Pelvic pain or discomfort. Many people associate pelvic pain with a doctor or muscle problems, but it is important to remember that the pelvic area is home to many different organs, including the prostate gland. A feeling of heaviness, discomfort, or even sharp pain in the lower abdomen, lower back, or genital area may be due to a growing tumor. This discomfort may radiate to the back, making it difficult to perform simple tasks such as walking or sitting for long periods of time. In later stages, the pain may become constant. Patients often confuse this symptom with muscle pain, which delays seeking help. Therefore, you should never underestimate persistent pelvic or lower back pain, as it may signal something more serious. Symptom 5. Changes in ejaculation. Prostate cancer can directly affect the processes involved in producing seminal fluid and releasing sperm. Some men notice a decrease in semen volume or experience pain during ejaculation. These episodes may be mistaken for an infection, but persistent symptoms are worth noting. In some cases, the tumor forms a narrower structure that changes the function of the ducts responsible for transporting sperm. This can lead to changes in the texture, color, or amount of fluid. If this condition persists for several weeks or worsens, it is necessary to consult a doctor. It is worth noting that in many cases, prostate cancer is diagnosed at this stage, before more pronounced urinary symptoms appear. Symptom 6. Difficulty maintaining an erection. Erectile function depends on a complex set of factors, including the health of the blood vessels, the nervous system, and, of course, the prostate gland. Although erectile dysfunction can have many causes, such as diabetes, circulatory problems, and medications, changes in the prostate gland can also play a role. Growing tumor cells can interfere with the movement of the penis's corpora cavernosa, disrupting erections. If erectile dysfunction occurs suddenly or progresses, it requires investigation. A simple consultation with a urologist can determine whether the cause is prostate cancer or another health condition. Seeking help earlier has the advantage of better management of funds and improved quality of life, regardless of the origin of the problem. Symptom 7. Feeling of pressure in the bladder. A common complaint of men with prostate problems is a constant feeling of a swollen bladder, even after urinating. This occurs because the growth or support of the prostate gland can create a partial obstruction to the complete elimination of urine, causing residual pressure in the pelvic area. Often, men strain their abdominal muscles to urinate, which creates discomfort. This symptom should not be ignored, as it can lead to consequences such as recurrent urinary tract infections, as residual urine in the bladder leads to multiple deaths. In addition to disrupting daily life, this condition can worsen symptoms such as nocturia. If the symptom persists, the best solution is to consult a specialist and conduct imaging studies and lab tests. Symptom 8. Not taking into account the weight. In many cancers, involuntary weight loss is a warning sign. Prostate cancer, especially in the later stages, can maintain metabolic changes and cause appetite. Although this symptom is most often associated with aggressive tumors, it is important to pay attention to any sudden changes in the entire body. Loss of muscle mass and fat without an obvious cause is often accompanied by persistent resistance, paleness and weakness. If you notice that you have more clothes, your appetite has decreased without a clear mind, it is worth sorting out the situation. Other health issues, such as hyperthyroidism and gastrointestinal disorders, can also cause weight loss, as a result of comprehensive medical examinations. Symptom 9. fatigue and constant light feeling unrelentingly tired even during normal activities can have many causes. However, when a tumor grows, the body often redirects demands to solve the problem or fights metabolic changes that lead to the formation of nutrients and saturation of tissues with oxygen. As a result, the result becomes an almost daily reality. Men who experience a noticeable decrease in energy without changing habits or stressful situations should consider the possibility that the state of their prostate health is negatively affected. This general weakness affects productivity, mood, and quality of life, especially when combined with other symptoms. Although the light is a nonspecific sign, its appearance is unsuitable. The role of regular screening when it comes to prostate cancer: there are two pieces of evidence: the PSA prostate-specific antigen test and the digital rectal exam. The PSA test is a blood test that measures the level of a protein produced by the prostate gland. Although a high PSA level does not always indicate cancer, significantly elevated values can be a warning sign. A digital rectal exam, on the other hand, allows you to assess the texture, size, and shape of the gland by palpation. The combination of these two methods increases the accuracy of detecting the disease. In some cases, the urologist may also order a transrectal ultrasound or MRI for examination. It is extremely important not to underestimate these examinations. Men aged 50 and older, as well as 45 years old if they have risk factors, should choose a specialist on the frequency of the ideal look. Confirming the diagnosis: what next? If the tests and biopsy reveal the presence of malignant cells in the prostate gland, the next step is staging and discussing treatment options. The most common approaches include surgery, radiation therapy, hormonal therapy, and in some cases, chemotherapy. The choice depends on factors such as the aggressiveness of the cancer, the patient's age, and overall health. Localized prostate cancer, limited to the gland, requires significant treatment. However, each case is unique, and treatment options must be individualized. Open communication with your doctor, ongoing doubt, and seeking a second opinion are recommended steps for anyone facing this change. Treatment options and pathological consequences: radical prostatectomy, surgery to remove the prostate gland, is one of the most commonly used treatments when the cancer is localized. However, it can lead to significant consequences such as urinary incontinence and erectile dysfunction. Radiation therapy, which can be external or internal brachytherapy, uses radiation to kill tumor cells. It can also see the front of the body, as well as irritate the bladder and rectum. Hormonal therapy works by reducing testosterone levels, a hormone that can stimulate tumor growth. However, this reduction can lead to hot flashes, decreased bone density, and changes in sex drive. Chemotherapy, on the other hand, is more often used in later stages when cancer cells have spread or when the tumor does not respond to other treatments. Although each approach has its own side effects, the effectiveness can be very high if the treatment is prescribed correctly. Quality of life during and after treatment: maintaining quality of life is a major issue, especially in areas with poor treatment outcomes. Supervised exercise, pelvic physiotherapy, and psychological support are valuable tools for recovery. Special devices can improve pelvic floor strength, reducing urinary incontinence problems.